Hello viewers, I am Dr. Jayalakshmi TK. I am Senior Consultant Pulmonologist at Apollo Hospital, Navi, Mumbai. Today we will talk on bronchial asthma. So, what is so important about asthma? The important thing about bronchial asthma is that it is a treatable condition. It can be fully controlled with medications. So, although it can come to any person, it's commoner in young people, it's commoner in children, but it can also come at any age. But it can be treated with the use of proper medications. So, what causes asthma? So, usually asthma is caused by narrowing of our airways or air passages. So this narrowing often occurs because of, we call it inflammation, means it is the usually triggered by some type of allergy. So many patients are allergic to dust or maybe to certain type of food, maybe to certain smells, maybe to certain pollen which is there in the environment in which they have seasonal problems. So these are called as triggers. So these triggers set off a reaction in their body, usually in their air passages or respiratory passages, which causes swelling in the respiratory passages and also causes narrowing because of a muscular contraction or spasm of the muscles, small smooth muscles which are there in the respiratory passages. This causes the airways to become narrow and the person is not able to breathe properly. He gets a choking sensation, and this is more when the person is breathing out. You will have noticed patients with asthma have wheezing sound when they breathe. So this is because of this narrowing. So how is it treated and how is it diagnosed? So usually we diagnose one on the basis of history. We ask the patient whether he has any allergy to any substances, whether there is a family history of allergy, whether there is a family history of asthma, because often asthma runs in families. We ask the patient whether there are any triggers which cause the problem to come on, maybe certain type of food, fish allergy, prawns allergy, nuts allergy. These are quite common type of allergies. So this is an allergic asthma. There can also be non-allergic asthma where it is just because of irritants like dust and the pollution in the environment. This can trigger off the asthma attack. Sometimes even respiratory infections can trigger off the attack. Like we can see you get a cold or a normal viral infection. They can suddenly trigger off an attack of asthma, wheezing, a spasmodic cough, and that cough can remain for a long time. We also saw that after the third wave of COVID, many patients had trigger of their asthma attack, and many patients who didn't have asthma also started coming with symptoms like asthma. So how do we diagnose it? We do a chest X-ray. Usually the chest X-ray will be normal in asthma. We do a blood test to see whether there is eosinophilia. We do a test to check the IgE level in the blood, which gives us information whether it's an allergic asthma or not. We do something called as a lung function test. Lung function test will show whether there is an obstruction in the airway. Important thing about asthmatics is that in between attacks they are normal. Their attacks can come on very severe, but in between attacks they may be normal, at least in the initial stages. And how do we treat? The best treatment which we have nowadays with us is the inhaled medications. Inhaled medications are usually a combination of inhaled steroid and a bronchodilator. Maybe initially the patient may require only inhaled steroid, not a combination medication. There are also other tablets which are anti-allergic tablets. There are other tablets which can also help the lungs to dilate. Sometimes in severe cases we need to give courses of oral steroid so that the swelling inside the airway subsides. But the inhaled medications usually are very good for helping to control asthma, to prevent asthma attacks, and to reduce the severity of asthma. So this is mostly about the treatment. There are nowadays new treatments like uh, uh, biological treatment for asthma. So what does this biological treatment do? So they act by working on the other mediators of asthma and preventing the secretion or the action of these mediators. So usually these biological agents have different names like omalizumab, benralizumab, pembrolizumab. So these are useful, but they are expensive. They are injections. Usually they can be given once a month, once in 2 months, and usually they need to be given for 1 to 2 years to have a benefit. So this is the common OPD treatment for asthma. And of course, when patients have a severe attack, we need to admit them. We need to give them injectables, nebulizers hospitalizations, oxygen sometimes they even require treatment in the ICU. But these severe attacks can be prevented by taking medications regularly, by preventing allergy, by preventing the exposure to the allergens. If you know to what you're allergic to, you can avoid exposing yourself to that. You can also do an allergic skin prick testing to see which agents you are allergic to. So these you also can be benefited by taking a vaccine like a flu vaccine, which helps to prevent getting attacks of flu. Of course, you know about COVID vaccination, which can prevent, which does not prevent, but at least it prevents severe attacks of COVID. So these are the general measures. As a general measure, we should avoid dust as much as possible. Dusty environment will usually trigger off asthmatic attacks. So this was in a very brief about asthma, and I hope you will adhere to your treatment, take the treatment regularly which has been prescribed by your doctor, and wish you all the best for having a good control on your asthma symptoms and for preventing attacks. Thank you so much.